Principles of bonding. Key terms. Bond or bonding is to connect or fasten, to bind. Items are jointed together at their surface in three main ways: by mechanical adhesion, physical interlocking, or by chemical adhesion, or by a combination of the two. Adhesion, the act of sticking two things together. In dentistry, the term is used frequently to describe the bonding or cementation process. Chemical adhesion occurs when atoms or molecules of dissimilar substances bond together. Adhesion differs from cohesion, in which attraction among atoms and molecules are like, similar materials holds them together. Etching or conditioning, terms used interchangeably to describe the process of preparing the surface of a tooth or restoration for bonding. The most common etching material, etchant, is phosphoric acid. Primer, a low viscosity resin applied as the first layer to penetrate etched surfaces to enhance bonding. Cure or polymerize, a reaction that links low molecular weight resin molecules, monomers, together into high molecular weight chains, polymers, that harden or set. The reaction can be initiated by strictly a chemical reaction, self-cure, by light in the blue wave spectrum, light cure, by a combination of the two, dual cure, or by heat. Wetting, ability of a liquid to wet or intimately contact a solid surface. Water beading on a wax car is an example of poor wetting. Wet dentin bonding, bonding to dentin that is kept moist after acid etching to facilitate penetration or bonding resins into the etched dentin. Smear layer, a tenacious surface layer of debris resulting from cutting the tooth during cavity preparation. It is composed mostly of fine particles of cut tooth structure. Bonding agent, a low viscosity resin that penetrates porosities and irregularities in the surface of the tooth or restoration, created by acid etching for the purpose of facilitating bonding. Hydrophilic, an attribute that allows a material to tolerate the presence of moisture. Hydrophobic, an attribute that does not allow a material to tolerate or perform well in the presence of moisture. Etch and rinse, also called total etch technique, a clinical technique that includes etching of both enamel and dentin as a separate step from the application of bonding agents. Products that use this technique are called etch and rinse bonding systems. Self-etch bonding system, a bonding system that does not use a separate etching procedure with phosphoric acid. The acid is contained in the resin primer and no rinsing is needed. Selective etching, technique where enamel is etched first with phosphoric acid prior to the application of self-etch acid primers that lack sufficient acidity to produce a good etch of the enamel. Universal bonding systems, a bonding system capable of bonding to tooth structure as well as most restorative dental materials. Hybrid layer, a resin dentin layer formed by intermixing a dentin bonding agent with collagen fibrils exposed by acid etching in the etched dentin surface. It serves as an excellent resin-rich layer onto which the restorative material, such as composite resin, can be bonded. Oxygen inhibited layer, also called air inhibited layer, a layer of unset resin on the surface of a polymerized resin that is prevented from curing by contact with oxygen in the air. Micro leakage, leakage of fluid and bacteria that occurs at the interface of the tooth and the restoration margins and is caused by microscopic gaps. Percolation, movement of fluid into and out of the microscopic gap of the restoration margin as a result of differences in expansion and contraction rates of the tooth in the restoration with temperature changes. Contamination, contact with a substance that interferes with bonding or lessens the chemical or mechanical properties. Contamination of the etched surface of the tooth with saliva before bonding. Hydrodynamic theory of tooth sensitivity, theory that explains how pain is caused by movement of pulpal fluid in open, unsealed dentinal tubules. Actions that cause a change in the pressure on the fluid within the dentinal tubules stimulate a pain response from nerve fibers in the odontoblastic processes that extend into the dentinal tubules from the pulp.